Good day, everyone. First of all, I'd like to thank the organizers of DAA11 for your kind invitation for me to participate in this important hybrid event. The Honorable Dr. Ronald Clandy, the Minister of Agriculture and Food Industries, the Honorable Dr. Patinggi Tanshri, the Premier of Sarawak, the chairperson, Exicom, and members of the official section of the Asian Fisheries Society, DAA 11 attendees, ladies and gentlemen. Thank you for the opportunity that you have given me to talk about drivers and pathways to disease emergence in aquaculture and possible solutions. With the growth of the aquaculture industry and its increasing importance to achieving the United Nations Sustainable Development Goals, issues of diseases of aquatic organisms need to be addressed by improving how we monitor and manage them. Health management, in its broadest sense, encompasses the reduction of the risk of disease spread through movement of live aquatic animals, the reduction of risks arising from the potential entry, establishment, or spread of pathogens and the diseases they cause. It also encompasses pre-border, border, and post-border activities in aquaculture, the implementation of required effective national and regional policies and regulatory frameworks, and the relevant national and regional capacity building requirements for addressing health management activities. Diseases in aquaculture are complex and they are difficult to identify and track in the aquatic environment. Key factors include the presence of the pathogen in both aquatic organism and the water source, the viable pathogen in the environment, presence of a susceptible host, and a viable infection route. In order to understand the emergence of diseases in aquaculture, we try to analyze the various factors, drivers, and pathways that contribute to the introduction and spread of diseases in aquaculture. There are many, and we try to categorize them into four: trade in aquatic organisms, knowledge of pathogens and their hosts, aquatic health management and disease control, and ecosystem change. Aquatic organisms are highly traded commodities where 70% are exposed to international trade. Invasive animals and pathogens can also be traded with the primary host. In terms of knowledge of pathogens and their hosts, aquatic organisms live in a unique aquatic medium. For unknown diseases and even for known diseases, there are still significant knowledge gaps regarding transmission, immunity, genetics. Diagnostics are focused on known or listed diseases. Breeding strategies are not in place for many species, and there are limited availability of efficacious and affordable vaccines. There are multiple institutions involved in aquatic health management, and there appears to be inadequate or poorly implemented biosecurity measures and low capacity for emergencies. There's also perceived low incentive to report on known and emergent diseases, and in addition, weak regulatory framework and public-private sector partnership. In terms of ecosystem change, the physical-chemical conditions in aquaculture are often suboptimal for the host. Aquatic hosts are cold-blooded and thus highly responsive to stressors. The aquatic medium is pathogen-rich. Diversity changes with environmental conditions, and pathogens evolve and spill over and spill back relative to wild populations. If we look at the chronology of disease emergence in aquaculture, this is how it looks like. In the 1970s, there were a few diseases of parasitic, fungal, and viral origin affecting salmon, shrimp, tilapia, and many finfish species in the case of EUS. Going into the 1980s, the number of shrimp pathogens, mostly viral, increased with a bacterial pathogen. We also saw the emergence of infectious salmon anemia and sea lice. Going into the 1990s, few more viral diseases of shrimp in the sector suffered from vibriosis, and we saw the emergence of KHB. In 2000 and onwards, more shrimp viral diseases appeared, and previously unknown diseases such as AHPND, TILB of tilapia, VNN of marine fish, and BHP, which is a shrimp parasite. The global trend in aquaculture is that serious diseases emerge, spread rapidly, and cause major production losses approximately every 3 to 5 years. There is often a long time lapse, typically years, from the time that a serious mortality event caused by an unknown and emerging pathogens observed in the field to its subsequent identification and confirmation, to global awareness, to the establishment and implementation of surveillance and reporting systems, and implementation of cost-effective risk management measures. This is one example, that of EUS, a fungal disease affecting many finfish species. It was first observed in the 1970s, the causative agent confirmed only in the 1980s. Here's a closer look at the timeline of the spread of EUS around the world from when it was first identified in Japan and northern Australia to more recent cases in Malawi in Africa. A second example is white spot disease of shrimp. It's probably the most serious disease of shrimp. Same scenario when it was first observed in the field in the 1980s, diagnosed in mid-1990s, and listed in 1997. You will see here the global distribution of white spot. The data shows the year of first report from almost 39 countries. A third example, AHPND, previously known as CMS, same story. AHPND is probably the most significant non-viral disease of shrimp. This shows the global distribution of AHPND since it was first detected in 2010, and the latest being in Okinawa, Japan, 10 years later. Next example is TILV, similar trend in the sense of being diagnosed a few years from its first observation in the field to becoming a listed disease. This is now the global distribution of TILB from its first observation in Israel and how quickly it spread to different countries and continents. TILV is still a controversial disease as some countries have not accepted its presence, even though they are published information as well as industry information. What I'm showing you here is an aquatic animal disease emergence causal web. This causal web organizes these drivers and pathways into upstream and downstream effects of disease emergence. Because the factors leading to exotic and endemic disease emergence are quite different, this scheme organizes emerging diseases into exotic and endemic to provide better understanding. You will see here that for exotic diseases, the exposure pathways include trade, newly emerging pathogen, husbandry practices such as use of live feed, and pathogens from wild populations. Now, if we look at the stress-related factors that increases the impact of endemic diseases, these may include changes in management practices such as intensification and diversification, soil and water chemistry, species farmed outside the native optimal range, species are selected for growth rather than disease resistance, climate change, and other sources of stress that increase pathogen virulence. Disease emergence, whether they are exotic or endemic, is affected by aspects related to detection and effective response. These aspects include surveillance capacity, availability of diagnostics, institutional coordination, research infrastructure, level of biosecurity, and available options for control. All of these combined will determine the consequence of disease emergence. After looking at this, is there something that we can do? These occurring diseases harm the aquaculture industry. Production and market losses are incurred, affecting livelihoods, export earnings, and food supply. The cost would have been much less if efforts were focused on prevention compared to the cost for biosecurity measures, compensation, and other alternatives. This brings us now to the importance of aquaculture health economics. Disease challenges must be properly handled for the aquaculture industry to be truly sustainable. The number of disease outbreaks, responses, and economic losses reflect the immaturity of the aquaculture industry and the current gaps in governance. Estimates of economic losses due to diseases in aquaculture exist, but due to a lack of systematic methods for assessing their impacts, they are difficult to validate. You will see here some figures available in the literature. A systematic way of assessing the economic and social impacts of aquatic diseases allows us to understand the context and gain a better picture of the complex adverse impacts and economic consequences. And this will allow, in turn, decision makers at policy, production, service provider levels to make evidence based and informed decisions for more effective resource allocation and for creating an environment for increased investment opportunities. With the growth of the aquaculture industry and its increasing importance to achieving the UN Sustainable Development Goals, issues of diseases of aquatic organisms need to be addressed by improving how we monitor and manage them. The progressive management pathway for improving aquaculture biosecurity or PMPAB is a new initiative that FAO and partners are promoting. It is an extension of FAO's progressive control pathways approach, which has been internationally adopted to assist countries develop risk mitigation strategies that reduce or prevent losses from major livestock diseases. Whereas most PCPs focus on control of specific diseases, the PMPAB focuses on diseases faced by aquaculture at the commodity and enterprise levels. It has four stages and follows the principles of being risk-based, collaborative, and progressive, with a good understanding of the epidemiological triad, showing the relationship between the pathogen and the susceptible aquatic population in a suitable environment that allows the transmission of the pathogen and development of the disease in the population. PMP-AB refers to a pathway aimed at enhancing aquaculture biosecurity capacity by building on existing frameworks, capacity, and appropriate tools using risk-based approaches and public-private sector partnership. You will see here the four stages. And stage one, biosecurity strategy or risk is defined. Stage two, biosecurity systems implemented. Stage three, enhanced biosecurity and preparedness. Stage four, sustainable biosecurity and health management systems are established to support national aquaculture sector. As countries and aquaculture enterprises advance along the pathway, the following outcomes are expected: reduce disease burden, improve health at farm and national levels, minimize global spread of diseases, optimize socio-economic benefits from aquaculture, attract investment opportunities into aquaculture, and achieve One Health goals. In the context of PMP, aquaculture biosecurity refers to the cost-effective management of risks posed by infectious agents to aquaculture through a strategic approach at enterprise, national, and international levels with shared public and private responsibilities. Stages 1 to 3 of the PMP has key indicators and activities, and I'm just showing you here an example for stage 1. These include stakeholder mapping, conduct of risk analysis where threats and critical points are identified, enabling environment put in place, and this may include identification of the competent authority, drafting of an aquatic pathogen list, formation of a public-private sector PMPAB task force, review of legislation, aquatic health training, and identification of a national laboratory. This shows an example of a flow chart for stage 1 completion divided into four categories, namely aquatic health service, sectors and stakeholders, surveillance, monitoring and diagnostics, and management and evaluation. There are indicative activities for each of the category, as you can see from this slide. Each stage also has key outcomes, and again, this is an example for stage 1. In order to reach stage 4, which is sustainable biosecurity and health management systems established to support national aquaculture sector, it is important that activities from stages 1 and 3 are continuously sustained, monitored, and improved. As in any new framework, supporting tools are necessary. However, please remember that PMPAB builds on what is existing, including tools to support its implementation. You will find here a list of existing tools, to name a few. For example, assessment tools such as that of the FAO Self-Assessment Survey, to evaluate capacity and performance on health management and biosecurity, the OIEPVS aquatics. There are also guidance documents in developing a national strategy on aquatic organism health and developing a national aquatic pathogen list, risk assessment combined with value chain analysis, design of an active surveillance. There are protocols for disease outbreak or aquatic mass mortality events, investigation, and diagnostics. Another relevant guidance is the 10-point best biosecurity practices to reduce risk and prevent AMR. Under the water health management and implementing biosecurity measures should take into account the following. Have a biosecurity plan, understand the hazards, identify the risks and risk pathways at critical points in the value chain, manage the risks through a combination of good aquaculture and effective biosecurity practices. Some important considerations are know your aquatic species, know your pathogens, know your systems, know your contamination pathways, source healthy seeds, maintain good environment, use antimicrobials prudently, respect food safety, and maintain good husbandry. There are also alternatives to antimicrobials that could be explored. These include vaccines, bacteriophages, quorum quenching, medicinal plants, bacteriocins, and others. More recently, SPF stocks have provided a means for the safe introduction of Penaeus vanomeae around the world, which is now the species of choice and its dominant species in shrimp farming. SPF is now part of a biosecurity strategy to prevent the introduction into the system of infected animals. This slide shows all the essential elements of any aquatic animal health protection program. They are all shown here, and this was developed by FAO back in the year 2000 during a regional project for 21 countries in Asia. National strategic planning on aquatic health management and biosecurity is vital to reduce the vulnerability in the aquatic sector to new and emerging diseases and the often ad hoc and reactive solutions to serious transboundary aquatic diseases, and mass mortality events in aquatic populations. FAO has long encouraged member countries to develop and formalize such national strategies. They are a broad yet comprehensive strategy to build and enhance capacity for the management of biosecurity and aquatic health. The development of the national strategy is a first step in the process and a requirement in the PMP-AB approach. Here are some examples of countries that have national strategies, and these are examples of regions and subregions that have aquatic biosecurity strategies. What you can see here are the four scenarios which gives any country at any stage of aquaculture development or whatever competence they have an entry point to PMP. For example, scenario one, these are countries with no aquaculture biosecurity strategy, but with aquaculture or starting with aquaculture. Scenario two, these are countries with existing strategies, some level of implementation. How can this be used, built on, revised, and expanded to fit the context of PMPAB? Scenario three, these are countries with advanced biosecurity strategies. What bottlenecks, lessons, and good practices can be used and updated to fit the context of PMPAB. And scenario four are countries whose aquaculture biosecurity is dependent on the biosecurity situation in neighboring countries due to shared water bodies, watersheds, or coastlines, and where a regional or sub-regional aquaculture biosecurity strategy is needed or already exists. What I would like to emphasize in the next few slides is that there are two important elements that are present in all stages of the PMPAB. These are risk assessment and emergency preparedness. So let us look at risk analysis first. The general framework for risk analysis developed by OIE typically consists of four major components: hazard identification, risk assessment, risk management, and risk communication. This tool can be combined with value chain analysis to identify and prioritize the points along the value chain and the major pathways of spread that may pose the greatest risk for disease transmission prior to implementing control measures. Value chain analysis includes an overall description of the activities, processes, or movements involving a commodity, the geographic locations in the country where this occurs, and stakeholders involved. Risk pathways around points in the value chain with the highest levels of risk should be prioritized. Critical control points are points in the risk pathway where biosecurity efforts can be focused to reduce or eliminate the risk of disease introduction and spread. It's important that biosecurity measures are selected based on their effectiveness in mitigating the risks and then prioritize based on their practicality and costs. The control of diseases in the aquaculture sector requires a multifaceted approach, and this often involves a combination of several risk mitigation measures at multiple points along the value chain, since one control measure may not be 100% effective. Risk management should aim to reduce the number of steps within the value chain, if at all possible, to limit the opportunities for disease introduction and spread between points. This can be difficult with smallholders that may have long or diverse value chain. Newly implemented biosecurity measures should be chosen based on their effectiveness, feasibility, cost benefits, and sustainability. Key stakeholders should be involved in the value chain analysis and risk analysis processes and development of biosecurity strategies from start to finish. The other important element is the emergency preparedness. Emergency preparedness is the ability to respond effectively and in a timely fashion to disease emergencies. It is also the capability to deal with emergency disease situation that requires a great deal of planning and coordination, including establishing operational, financial, and legislative mechanisms and making available the required resources such as skilled personnel, essential equipment, and advanced emergency fund. Contingency planning and emergency preparedness require advanced documentation, which we call as disease strategy manuals. FAO have such manuals for IMNV, AHPND, TILV, and we are finalizing three more on EUS, WSSV, and PIV1. If you look at the contents of the strategy manual, it uses a template based on the Asia guidelines on emergency preparedness. They are divided into several chapters, such as the nature of the disease, diagnosis, prevention and treatment, epidemiology, control and eradication, and policy. So these are some of my key messages. The effectiveness of biosecurity measures are validated by practitioners and the industry. Science is explained by the academe. Governance authorities facilitates and disseminates and provide an enabling environment. A holistic approach is needed not only at the farm facility, but also looking at the whole value chain from seed source to market, because each segment has some risk element. The risk-based thinking is needed and should be an everyday practice. Aquaculture solutions is very dependent on local conditions. The PMPAB offers a big picture and farm level perspectives and uses risk-based thinking and collaborative approach among governance authorities, industry, and academia. PMP works for moving countries forward in a guidance context. Each stage provides a tangible benefit to stakeholders, and it will be part of the work within each stage to demonstrate, communicate, and advocate for activities that solve challenges inherent in retaining commitment. Stages can be considered as an elevator where you get on at your floor and stop at the floor, which has the needs for your aquaculture industry. But everyone is in the same biosecure building, which help global communication and share experiences as everyone's aquaculture biosecurity progresses. Biosecurity progress at all levels is a good news story. Disease prevention is an aquaculture strength that benefits the sector itself, wild resources, and the environment. Co-management approach, greater use of planning processes that brings stakeholders together is one of the benefit of PMPAB. It provides a solid platform for public-private sector partnership as PMPAB implementation plans should be developed between industry stakeholders and governance authorities to ensure buy-in best fit for country, but a template that provides a degree of consistency between participating countries or region. It promotes risk ownership, active engagement, and long-term commitment to risk management. It also helps in making governance mechanisms and, as mentioned earlier, a range of toolkits available to support its implementation. It helps in targeting specific entry points for any country. It gives an opportunity for longevity sufficiently responsive to environmental and anthropological challenges, enabling policy environments and adoption of sound aquaculture production practices. Before I end my presentation, I would just like to share our work at FAO for those who may not be familiar with it. FAO is a specialized technical organization of the United Nations. FAO's strategic framework revolves around what we call as four betters: better production, better nutrition, better life, and better environment. The Fisheries and Aquaculture Division has three thematic areas such as sustainable fisheries, sustainable aquaculture, and sustainable trade and value chain. My team is responsible for food safety, nutrition and health, and biosecurity, and we are under the third thematic area. FAO's work are also anchored in what we call as priority program areas or PPAs, and my team's work is very relevant to PPAs on One Health and Biosecurity, safe food, and climate change. I'd like to apologize for not being able to attend physically. It is DAA11 due to some health and flight reasons. Thank you very much for your kind attention.